It is my privilege to welcome each and every one of you to this webinar today on health diplomacy in pandemic times. I'm especially grateful to our chief guests, Professor Dr. V.K. Paul, Member, Health, Niti Aayog, and also Dr. J.N. Srivastav, the Executive Director of the NHSRC, for agreeing to be our chief guests and for contributing towards this topic. I'm also happy that we have such eminent resource persons as Dr. Sanjeev Kumar, the chair of the IAPH and former executive director of NHSRC and senior advisor of UNICEF, Dr. Daya Krishnan Mangal, Dean Research, IIHMR, and Dr. Satish Kumar, member IPHA and on board member of Ayushman Bharat, who have very kindly consented to enlighten us on this extremely vital and emerging topic. St. Stephen's Hospital has been a leading light in the Delhi medical circles for the past 135 years. Besides all the primary task of serving the citizens of this city and its surroundings in the field of health, it has also been a champion of medical education and research, and has always supported exploration of new areas which are covered broadly under the entire topic of health. Our Department of Community Health is well known as being one of the leading departments in the city and possibly even in the country, because we are dealing with an urban slum population of around 70,000 people to whom we've been catering to for over 37 years. The many innovative programs that this department has started have shown the way to many other such programs which have sprung up across the country. Our child-to-child education, the emphasis that is given to computerization of records and keep complete health records of the entire population. These are just a few of our initiatives which have gained acceptance across the country. And therefore, when it came to this webinar, I was happy that we are taking a lead in this, because I believe this is the first such webinar on this topic. The pandemic times have been trying for all of us, not just for the medical profession, but for governments across the world who have had to adjust suddenly to a new reality, and also to the populace, which has had to bear the brunt of this disease. And we have seen a lot of evolution over the past 1 year. Of course, in the field of medical care directly, yes, we have seen ourselves go from knowing nothing about this virus and its effects or how to handle its management, to gaining fairly in-depth knowledge today of means of controlling its spread. In the shortest period in the history of mankind, a vaccine has been developed, multiple vaccines have been developed to deal with prevention of future infections. This is a record, and our country has been in the forefront of this fight against the coronavirus. We are proud of the way that this has been handled. We are extremely proud that India, despite having had so many infections in a land that is so vast, which has one of the largest populations in the world, which also has tremendous logistical challenges. Under such circumstances, our country has performed so well and has shown the way to many other countries which are much richer in resources and much more advanced in their development. The very fact that our mortality rate is among the lowest in the world, and also the very fact that despite our population being so large, the numbers of people infected as a ratio of the population are so few, is testimony to the fact that our country has done something right. And this pandemic has tried the patience of every person who has been involved in its management. Also, our country has shown the way towards health diplomacy in such times. The very first effect of this was when, on request, India released vast doses of chloroquine, hydroxychloroquine, HCQ as we call it, to other countries. Despite knowing that we may face shortages in time if this proves to be an effective remedy, we were selfless and decided to share what we had with the world. This is really a matter of pride, and we are grateful to the leaders who came up with such solutions. Subsequent to this, India has been willing to share our share of vaccinations, our share of immunization, willing to share doses with so many other nations. All of this has resulted in the image of India in the eyes of the world improving, and we have shown that as a country we are not selfish but selfless. And this is what health diplomacy is about. It is about nations reaching out to each other and working together for a common good. It is about nations looking to imprint their footprints on history by saying, yes, when the time came, we were up to the challenge and to the task. It is about nations caring not only for their citizens, but recognizing their role in the global community and caring for the citizens of the world. We know that these are still early days in the control of the coronavirus. But health diplomacy will not be restricted and cannot be restricted only in relation to this pandemic. It is here to stay. And for us to use this as a successful tool, as to showcase India on the stage of this world as a vibrant democracy, as a nation that has taken the lead in so many areas and is today finding its rightful, proud place in the nations of the world. That we will continue with many areas of engagement with other nations and use this not just for the betterment of our image or for the betterment only of our people, but use it for improving global health and global cooperation. I do hope that this workshop that has been arranged would enlighten many people, would open people's eyes as to the possibilities of what can be achieved through health diplomacy. I thank our department who have organized this, for the initiative they've taken. Dr. Abha Mangal and her team have done a tremendous job. We are proud of them. And I wish each and every one of you a good learning experience so that we can continue to work together. Thank you.